And we warmly welcome our last panel, or second final panel for today, which is chaired by Jay Stewart, or Dr. Jay Stewart from Gendered Intelligence. And yes, thank you, Jay.
Brilliant, thank you. Can everybody hear me? We just had to put another chair in. Welcome to the second panel. Today, this afternoon, we're going to talk about less about spaces, more about services. So what might adequate services, trans-inclusive services, and trans-led services kind of look like? And also thinking about housing as well for trans Londoners, trans people in the London area. So I'm just going to get people to introduce themselves. I'll say a little bit about myself. So my name is Jay Stewart. I'm one of the co-founders of Gendered Intelligence. We work with probably about just under 1,000 young trans people each year, and that's mostly in the London area. So we're quite large now, really supporting young questioning, gender diverse and trans people to gather, to come together, to feel a sense of community, to increase a sense of pride in their identity, and to build resilience. It's all about how do we manage the setbacks. We've talked a little bit about how complex and difficult it can be out there. So how can we provide spaces that feel safe and build that resilience? That's some of the things that we do. Okay, so if we just start from the end, if people can say...
I was going to get all nervous that it meant along to me, but now, okay.
Cut the chase, yeah. So do you want to just say a little bit about yourself, names, pronouns, and kind of what your role is to just let people...
Okay, I'm Michelle Ross, and my pronouns are she and they, and I'm the founder of Clinic Q, and sexual health and wellbeing and HIV. I've been involved with that for over 30 years, and I'm a psychotherapist, and is that enough, or do you want me to go on a bit more? We have 14 therapists at Clinic Q who work every day of the week. I'm mostly online now since COVID happened. We used to see people at a North London centre, counselling centre, but then when that happened, that closed, and so we went online. And it was almost like creating a new service when we went online, because we looked at the governance, the ethics, the safeguarding issues, and I would love to talk more about that as we carry on. And also, we have a partnership service with King's College Hospital, where we co-deliver our sexual health, HIV and wellbeing service. It's quite a comprehensive service, like doing bloods for hormones, doing cervical screening, a range of things. And that's been a great success. And that's supported by Lambeth, Southwark and Lewisham, as well as King's College Hospital as well. And that's on a Tuesday from 4 o'clock to 7. It used to be a walk-in before COVID, and we'd have a lot of people in what is usually a waiting area, and we make that very much a community space where people could come, have chocolate biscuits, or whatever other biscuits they want to eat, have a cup of tea, have a coffee, chat, come with friends while they have a service. And when COVID happened, we had to go by appointments, and that's really worked out very well. So people come and they get that appointment, and they're not waiting too long usually. They're there, they get that on time, they get that appointment usually on time. And so that's how it is. Hello.
It's interesting to hear about how COVID has impacted, so we might come back to you. Tom, do you want to say a little bit about yourself?
Yes, hello everyone, I'm Tom Copley, pronouns he, him, Deputy Mayor of London for Housing and Residential Development. So overseeing the Mayor's 2 affordable homes programmes, our commission services for rough sleepers and victims of domestic abuse, the Mayor's work on the private rented sector, and things like our work on building safety as well.
That sounds quite comprehensive. Quite a big portfolio. Brilliant, great to have you here. Maury.
Hi, I'm Mari. I'm the interim chief executive of the Outside Project. Before that, I was director of services at Stonewall Housing. I've basically just done I haven't done Tonic, but I've done every other LGBT housing service and worked my way around from the foundation, Albert Kennedy Trust. Yeah, I've been in the sector for a while.
Do you want to just say a little bit about the Outside project?
Yeah, so the Outside project has a number of services. We, at the moment, with it being winter, we've got funded through actually from the GLA's rough sleeping strategy. We've got an emergency response over the winter period with I think about 10 beds for people. And we would normally have had a shelter, traditional shelter with lots of beds in the same space. But because of COVID, it has to be single occupancy. So there's been a lot of challenges for the housing sector in that regard. We also have a community centre where there's lots of different groups there. Book 28, which is like an LGBT library. We have a queer coffee morning on a Wednesday. It's really popular. So yeah, and we also have another housing project which is more long-term for people. And we have a domestic abuse project, and that was like something that came out of COVID in terms of the number of domestic abuse cases we were seeing for LGBT people. Yes, that's sort of
really important work. Thanks, Maury. Jolly.
Hi, my name is George Seville. My pronouns are he, him. I'm the co-director of an organisation called Black Trans Foundation, and we provide free therapeutic services for trans people in the UK.
Brilliant, thank you. We'll come back as well about a bit more about that. Michael?
Hi everybody, I'm Michael Brady. My pronouns are he and him. I have a number of hats. I'm the National Advisor for LGBT Health at NHS England, and in that role I have the very big responsibility with a very small but amazing team to address LGBT health inequalities across the whole of the NHS to improve access, to improve experience and to improve outcomes. So we work in an advisory way, that's a nice way of saying it sometimes, within NHS England and across the system, so with hospital trusts, with regulators like CQC and GMC and Royal Colleges and so on and so forth to make things better. I'm also a sexual health and HIV consultant at King's College Hospital, so I come at this from both the kind of bigger picture, policy, strategy, political way, but also as a service deliverer, and you've already heard from my wonderful colleague Michelle, so I co-deliver the sexual health service at King's with Clinic Q that Michelle mentioned earlier, and we provide a full range of sexual health services, cervical screening, support for people who are self-sourcing hormone therapy or having to pay privately at King's, and that's something perhaps we'll touch on a bit later.
Brilliant, thank you. Well, maybe we stick with that service and the NHS then in terms of, I guess my first question is about COVID and how it has impacted on services. So if you can say a little bit, I mean, I think what we're kind of thinking about here is mainstream services and trans inclusion, and then specific specialised services that are for trans people, kind of by trans people. So what has been the major impacts of COVID on the services that you look after at the NHS?
So I think for the answer is similar to many answers. It's made a bad situation worse, in the same way as we're thinking about the broader inequalities. So, access to services, the experience in services was poor, and certainly poorer than cisgender people before the pandemic, and it got worse during the pandemic. And obviously the communities have been impacted in the same way that everybody was impacted. Everything shut down, everything was really difficult to get into, everything went digital or over the phone, and if you don't have a good relationship with your GP to start with, or your GP doesn't have a good relationship with you, or you're not comfortable accessing a service that's not inclusive of you as an individual to start with, then it's even harder to do that when you're being forced to do it with a barrier. So I think that the broad impact was heightened because of the existing challenges that trans and non-binary people face anyway. Clearly the specialist services in terms of gender identity clinics, which already have hugely unacceptable waiting lists, got even bigger waiting lists, and I think it's probably fair to say they were not the quickest to adopt virtual consultations, video consultations, which actually I think for some people, as it is for some people across the whole of healthcare, have actually been liberating. I think actually some people, having the option to not have to travel a long way to the clinic, having the option to have a consultation in your own home over video actually is much more preferable than going in. But then obviously for others, particularly if you can't, if you don't have a device or if you can't afford the Wi-Fi, it's not. It's a barrier. So I think there's those things. I mean, Michelle mentioned. I mean, just using our specific example. I mean, the limitations of social distancing and the fact that most of us in healthcare were redeployed to go and work on COVID wards meant that we had to restrict the services. It was great actually before when it was a walk-in service, and actually it probably did function equally as a community space as it did a clinical space. It was often difficult. There were probably more people there having the lovely tea and biscuits, courtesy of Clinic Q, always Marks and Spencer's, than there were people coming to see me, which is great. But it had a nice vibe to it, and it's working fine now. We can't do that because of the distancing, but it is an element that we lost because of COVID.
Anything to add from your side, Michelle? About,
Oh yeah, just to say that when people do come, they do fall in love with Michael a bit, and that's not just because you're here, because you give such a brilliant service. And I don't know if I made it clear, Clinic Q is by trans people, for trans people. We're very much a trans organisation with very little funding. Anybody out there? And that kind of got worse. But just to add some more to that. I think because we had so many people, about 20 people in what was a community space, eating chocolate biscuits, Michael. And I think, sometimes people would be waiting for an hour and a half before they got seen. What the appointments have done is people get seen on appointment time, usually very much on time. And, we have Michael, who leads on the service, the clinical service, and I lead on many of the other services. And we have Sarah, who's over there, who's very much involved with our Tuesday service as well as other people. I'm going off track. What did you ask me?
Just impact of COVID. So some positives. What are the negatives? So you said about heightened inequalities. Can we kind of flesh that out in terms of what was going on?
Okay. Can I talk about our counselling services then?
Yeah.
Because what happened was, when we went online, let me start again. Before we went online, we mainly saw people from London and the South East who travelled in to see our therapy centre. When we went online, it opened up to the whole of the UK, and we were flooded, absolutely overwhelmed with the response. And I think that might be similar to other services that did that as well. And it really highlighted the difference. But what we were able to do, people who couldn't physically get to us, we were able to work with those people, whether that was through a physical health issue or a mental health issue, that they couldn't actually travel to us. This really opened up that service to a whole range of people that might have felt excluded from travelling to us, and it made such a positive difference. There is something I want to say about, and I don't know how to say it now, but what it's also highlighted is the lack of safe housing, safe living, because some of our counsellors are having to work with people on their phones, on Zoom, while that person's in the park or in another outside space where they're not overheard, because where they live isn't safe to talk about either their identity or to talk privately, because they might be sharing a room with several other people. And that's really highlighted that. But it means that they can access a service, whether it's on the phone in a park or somewhere.
Joliffe, do you want to come in here about your service and what you've noticed since COVID?
Yeah, I mean, I think that it bears repeating that the GIC was one of the first services in the NHS to close down when the pandemic started. And the inefficiency and dehumanising treatment of trans people that the GIC is guilty of became significantly worse, surgeries being cancelled. We saw the highest rates of emergency mental health referrals in the NHS's history in June of 2020. And our organisation was built primarily to provide what the NHS cannot and will not provide for our community. We had no other choice but to come together to create what was at first an emergency response to a health crisis, both physical and mental. And we had to build that in the context of the pandemic. We had to set up a therapy service that mostly operated on Zoom. It has been something that we have started to move out of a little bit, building the organisational framework to be able to provide IRL services. But it has been absolutely devastating, and something that is not discussed enough is the fatalities that has cost trans communities in the UK. As some of you may or may not be aware, the GIC, the waiting list for the initial appointment for a GIC, is the longest on the NHS by about 4.5 years. If I were to join that waiting list today, I should expect my first appointment with a gender identity clinic in about 26 years at the current rate at which they are moving. There is no other service on the NHS that operates that inefficiently. And part of that is because trans health and trans wellness is seen as an optional extra. Our access to healthcare is dismissed as non-urgent, non-essential, especially when that already coalesces with other intersections of those communities, especially when that manifests in black trans people and how they are marginalised within our healthcare system. It's a nightmare.
And so well done for doing what you've done and being able to, and a little bit about community work, community practice, grassroots, finding solutions. It does actually feel a little bit like the 80s, doesn't it, at the moment, in terms of so much grassroots activism coming through and actually establishing very professional services and being structured and solid with the services that we offer in our community. So just amazing, power to you and your team to have done what you've achieved so far, and I hope you continue to thrive and to build resource and to attract funding as well going forward.
Yeah, I thank you for that. I spoke at a panel at the Glass House, which Rico mentioned earlier, queer community space in Shoreditch with a lot of AIDS activists from the 80s, and there was a real exchange of understanding of living in a environment of healthcare activism that is so hostile towards queer community, the disregard for queer life, especially trans life in the UK, a dismissal of those rates. I mean, there is, we are currently living through a moral panic and a response to a queer health crisis that is unparalleled to anything other than that of HIV during the 80s. And so I think that comparison is really apt and important to note in a lineage of queer healthcare work.
Thanks. So should we move on to the housing as well? So what are you finding in your job, in your services with regards to impact of COVID in housing for trans Londoners? Tom, and then I'll come to Maureen.
I think sort of the points we've heard about this already are really pertinent. I mean, look, for a huge number of people during the pandemic, the pandemic really highlighted all of these pre-existing inequalities that we all know about already with housing. People being happy to be in their homes all day, not being able to go outside. The impact of that on people, particularly if you're living in overcrowded accommodation, or perhaps if you're sharing in a flat share with people that you don't particularly like. Now, I'm sure many of us have had flat shares with people we don't particularly like, but if you're a trans person, it becomes something more than something that is just an irritant. It is a lot more serious than that. So I certainly think there's been a disproportionate impact there. There is a sort of big sort of macro issue here as well. We do not have enough homes in London, which leads to people living in circumstances that they would not wish to be living in. We need far more decent, affordable homes, which is why we are doing what we can with the funding that we get from the government in order to fund that. But I'm also really proud of some of the more specialist stuff that we've been able to do as well. And we've got Anna, I'm sitting at the front here, I'm going to embarrass her, of course, who runs Tonic Housing Association, which is established the UK's first LGBT affirming retirement community, and it was wonderful to be at a launch a few months ago. Very proud that we were able to part fund it with some of our funding from City Hall. But just hearing some of these tragic cases of LGBTQ people who, when they come to need to go into retirement housing are sometimes forced back into the closet. Just demonstrates the importance of having that sort of housing that we just bought. Similarly, very proud to support the Outside project. 24% of young homeless people, are LGBTQ. It's absolutely vital that we have these services that can cater to LGBTQ people.
Brilliant. Maury, do you want to build on that in terms of what you've noticed on the ground with people coming through the service?
Sure. I think like one of the good things to come out of COVID is the way that everybody in the scheme that took all the offered most of the people that were rough sleeping or homeless a space in hotels that the GLA took over. There was quite a few, and it's been quite interesting to see that. I think it's in terms of, politicians always talk about how difficult it would be to end homelessness or end rough sleeping, and it was really interesting to see actually just throw a bit of money at it and it's sorted, which we all sort of knew anyway. But yeah, so that's been really interesting. But I think like what Tom was saying in terms of those hotels and how safe they were for queer people, we were able to take ground floor of one of the hotels actually and run that specifically for LGBT people, so there was a safe space. But we did experience people that were in other hotels that came to us had quite a rough time with both transphobia, and the staff that also weren't very well trained in terms of dealing with LGBT people, particularly trans people, like pronouns, all sorts of things like that, also like names and legal names, and yeah, there was quite a lot of issues for people. I think, what else was the question?
What about kind of some experiences that you found from people coming through and what COVID was bringing up for them in terms of their circumstances?
Yeah, I think one of the things that we've seen is that like domestic abuse really increased during COVID. I think like what Tom was saying, when people are together, there's an intensity when lockdown happens. So if there was already a fragile relationship, then that generally got worse. And we found that domestic abuse really, really spiked. And we were lucky to get some money from MOPAC to deliver. It was a really, really small project, but it's called STAR actually, after the Star House with Marsha P. Johnson. It's sort of that, so he's got a refuge called Star Refuge, which we've been working on to try and develop. And we've got some funding to try and develop that over the next couple of years, and we hope that MOPAC are going to support us with that, so we'll see. But yeah, thank you. Yeah, so we're looking to continue that. So I mean, I think there's been a couple of things that have happened, and it's like, oh, this is like actually quite good, and I think that was one of the things, to be able to get Star Refuge and think this could be a legacy project. This is something that was really, really needed anyway. There was nothing else, there was no other service that was providing accommodation for people experiencing domestic abuse. So, this is really important for the community. And I think when we look at trans people specifically, the experiences of trans women in terms of domestic violence is incredibly high, and sexual violence is also incredibly high. And that's really quite a complicated issue around the sexualisation of trans women, and the sort of relationships they have with cisgendered men, and how that generally puts them at high risk both of homicide, domestic abuse. It's quite rough. So we hope that STAR will be something in the future that might even just provide. I'd like to have a trans-specific refuge at some point. So.
And why do you think part of the offer is to provide a space solely for trans kind of clients? What would be your argument to defend that sort of specialist service as opposed to sort of in a mainstream?
Yeah, I think we need specialist services, but it's really important that those services are buying for. We see people trying to create services or create like LGBT services within a mainstream like sector, like St Mungo's might try and do something that's LGBT. And it just doesn't work. From what I've seen, I think services need to be buying for, and it needs to be members of our community delivering that service. because we really understand each other.
Can I just add something just on that? So the GLA recently was given responsibility for commissioning services for victims of domestic abuse. It's a new duty that we now have, and we so have some funding from the government to do that. We launched our draft the Mayor's draft domestic abuse strategy, which I'd encourage people to comment on. Actually, it's quite a short consultation period. But one of the things that we've expressed a desire for is for people to bid for LGBTQ specific domestic violence services. So I'd encourage people to have a look at the strategy.
Michelle,
That's a myself.
Michelle, and then John.
Yeah, can I just say, okay, I was really pleased that you're here and to hear, I've read about the time at home there. And this is, I transitioned 50 years ago, so I'm an older trans person now. And, I know a number of older trans people who have lived with stigma all their life. They've lived with fear of services. They've lived with an embodied concern and fear of going into a retirement home, going into a care home, and might not have the opportunity to go in the closet for many different reasons, or might be very much in stealth and be in the closet, as you might call it, in stealth, and fearful of that somehow being exposed when they've never talked about themselves being trans for most of their life. And it really concerns me that provision for older trans people and non-binary people, and what that really means, it's for some people would rather end their life than go into, and I know that can be said for a lot of older people, whoever they are, but specifically for trans people, it is a genuine concern and fear. I just wanted to say that.
Yeah, no, that's good.
Does
Does this echo with you in terms of buy and force, sort of specialist services and making the argument? But to add to that, what do you think the sustainable model is going forward? Like, how can we sustain these specialist services? Or is that a long-term goal even?
Yeah, I mean, it's undeniable that these specialist services are essential. When we opened the application for Black Trans Foundation for our therapy service, our spots were filled in under a minute. The demand for what we do was so high, and this is true for, as you'll see, across like the LGBT sector. All of these organisations are so profoundly oversubscribed. Their waiting lists are so long, the demand is so high. The answer to that, in some ways, is quite simple, is that we need to be funded. There is, especially like in the third sector, I think there is a culture of tokenism around trans-specific services and queer-specific services. The idea that to make a service that is for like such a specific demographic, often when we liaise with funders, we are told that it is a waste of time. We are told that we should be diversifying, like why Black and trans specific, why not queer people of colour more generally within. And that is because often spaces and services that are broader, that speak to a bigger part of our community, are still unsafe for trans people, are still unsafe for trans people of other intersectional experiences. I think especially when it comes to housing, it's important to understand how marginalization because of transhood then leads to like a closer proximity to violence in other spaces. The average trans person in the UK makes under £17,000 a year. That is an absolute poverty wage. That means that access to housing under the system that we have means it's much less likely for them to have access to guarantor, much less likely to be accepted by a landlord because the likelihood of them being on universal credit, on DSS is much higher. All of these barriers to trans community safety are like systemic from the top down. It's like right down to the root, and like there is no Transhood is not separate from the other ways in which we walk through society as like trans people with disabilities, trans POC. We face those barriers that are sort of aggregate, accumulative through our transhood that keep us outside of accessing services that other people can.
And so do you feel like your service is here for a long time, that need is going to retain, with regards to knowing that the barriers are going to be so significant accessing mainstream services that black trans people and trans people maybe more broadly are going to be not able to afford a therapeutic service like in the private sector? Like, where do you see your service in 5 years' time, say?
I mean, we would love to be able to grow the service. So far, we are a team of 3 that has put nearly 100 black trans people through therapy this year, since we opened the service. But there is a big difference between an organisation that forms out of like an emergency community response and one that has the infrastructure to be able to provide long-term, sustainable and like quality services to a community. The difference between those is money and time. As I'm sure many of you will be aware of, in June 2020 when Black Trans Foundation formed, many funders could not throw enough money at black grassroots organisations. That has now changed. Our needs as a community are no longer in the public zeitgeist in the same way. It is less fashionable to advocate for black community, for trans community. And so I think that, like, you know, NHS capacity, withstanding or notwithstanding as the case is, I think that services like mine and other grassroots organisations that come from trans community will only need to be built larger and longer term, needing to like have the support of funding bodies through the third sector. Because also, like, it takes a huge amount of labour. Like the hours when you work as like a frontline trans healthcare worker are huge. The toll that it takes, the trauma that you carry, the amount of like what you have to do when you're working in frontline trans healthcare, it's traumatic. People burn out. We see so many trans healthcare organisations that flame out after 2 years because there is nobody in that organisation that has the capacity to keep them going. And so part of making sure that you have a service that is sustainable is to make sure that you, as organisers, as community, have the resources to care for each other, to be able to do that work, to support each other to be able to do that work, and also access to healthcare for those workers, access to therapy to be able to deal with the trauma that they hold within their community, which, yeah, takes money.
I know at GI we've been talking about, you know, it's time to put our oxygen masks on first and like really reminding practitioners to be doing that. Michael, you can chip in here in terms of specialist services, but opening out to mainstream services as well. I guess my question is, what's the work around ensuring that mainstream healthcare services and other services journey towards better trans inclusion, so that in the long term, trans people can have a reduction in barriers and a positive experience accessing, you know, the services that they're entitled to?
Okay, I might say a little thing about that specialist generalist thing, because this is something that I think about a lot, and I completely agree with everything that everybody's said. You know, we do need specialist services because the need is so great, and because those areas where the problems are so difficult, and we know what those are. We've heard about them, and absolutely, I completely agree that it has to be, you know, by and for. I mean, you know, and that's why we deliver our service in partnership with Clinic Q. There's a reason it's called Clinic Q at King's. You know, I think the establishment in this area, whether that's us in the NHS or local authorities or whoever, have to recognise that there is a huge confidence, trust deficit in us as the establishment and as service providers. You know, and it's you know, so we have to bridge that. You know, I can't just open a transsexual health clinic and expect everyone's going to feel comfortable coming to see it. You know, I need it to be designed by, delivered by people from that community. So I completely agree with all of that. I mean, my only thing about it, this is something I think about, sort of a bit of a tension when I'm thinking particularly about where I work in sexual health services, is that accepting that those specialist services are so important, it shouldn't let everybody else off the hook. So I think there's something there about how we actually merge the mainstream generic services, whatever merge means, whether that, you know, whatever that means, you know, partnership working, training, you know, workforce development, capacity building, sharing. You know, there has to be a connection, and we've seen that in this little micro way in our sexual health service. You know, our generic sexual health service is definitely more trans-inclusive than it used to be since we started our service, partly because Michelle and colleagues have done some training, but people just think about it a bit more. They think about pronouns, they think about the gendered approach they're taking, they think about the sign on the toilets or whatever, you know. But so it is better, I would say, for a trans person to come to our generic service because the specialist service exists and because there's a link between the two. So I think there's a lot that, and I think it is fundamentally the responsibility of the NHS to reach out, to make those connections and to build those partnerships, and to be confident enough to say that we need you and we need to learn from you to make our generic services better. So the second bit was, what can we, I'll be quick, and I'll be a little bit now. So I think just my general thoughts, because this is what a lot of what me and my team think about during the day, you know, how can we make mainstream services more trans-inclusive, or generally more LGBT plus inclusive. I mean, I think for me there's a few steps and different bits of the service, of the system, are at different stages of that. The first step is just a fundamental think about it. Too often people don't even think about it. You know, they don't even think about their trans service users, or what their policy how it will impact on gender diverse people, or what their maternity service leaflet that talks about women means for trans men or non-binary people. So the biggest challenge is just to get people to think about it in the first place. And then the next step, I think, it was talked about a lot in the first session, is that people then need to step back and just listen and not think that they've got the answers. You know, so even those people that think about it, their next step is then, oh, I've got the solution for that. And then, well, have you actually talked to any trans people, or have you actually asked them what they think, or have you actually sat down at a table with a blank sheet of paper and designed it? So getting rid of that establishment arrogance to think that you think you have the question, and not involving the people who actually have the answers. And then I think that then the next stage, and some people are at that stage in the system, you know, there are lots of pockets of good practice in amongst all of the terrible experience that a lot of people experience. It's then, once you've done acknowledge it, listen to the community, then do it with the community. You know, and I think that's the other thing, and that goes back to you've got to co-deliver things. You know, that's how we at least get closer to the buyers for us thing in a generic system if we're co-delivering, and that can look different. It can be an equal 50-50 partnership like we have, or it could just simply be meeting once a year or reviewing policies or thinking about them. Do you know what I mean? It can be relatively light touch, or it can be very, very full on, and I think we need something across the whole of the scale. And then after that, I mean, this is my main frustration, is that it just is just relatively simple. It really should be. You know, it's actually, we've talked about this before, about the census and data. Actually start asking the question about your trans, non-binary and gender diverse service users, so you actually know how many use your service, because then you'll be really surprised. And then think about their experience, because their experience will be worse than everybody else's, and then start to do something about it. So,
brilliant. Michelle, did you want to chip in here?
Oh, yes, I do. Just to say, Clinic Here is 10 years old in February, and it seems to have gone really quickly that time. But we made quite some changes in various areas. And because I could say, oh, nothing's changed, but it has. We have to say, acknowledge that. But in that time, in that 10 years, we've worked throughout with the NHS. And again, not because Mike was here, but the embracement. Kings have embraced what Clinic U does. And I'm working with other areas within Kings that are not specifically around trans services, but helping to make them more inclusive. And I want to see all health services throughout the NHS trans-inclusive, because we don't live in a bubble of only gender care or sexual health, or all health for human beings is what affects trans people as well. And I want trans people to be able to go to their local GP, to get a blood test, to get a smear, and not be told, no, you have to go somewhere else. Yes, I think there's a need for specialist services, like KinderQ and others, but it needs to be wider. I think we're worthy of both or all services, and it's really important that that goes forward.
Brilliant, and it's the both and, isn't it, approach, definitely, that it's not one or the other.
Yeah.
Is this chiming with you, Tom, as well, in the housing provision? Like, what would trans inclusion look like in housing provision?
So I think, a few years ago, in this very room actually, I hosted the launch of a report that House Proud did called There's No Place Like Home, which examined the experiences of LGBTQ people, residents of social housing. And there were some quite striking things in there. And actually, in terms of when people were asked, you know, how connected or comfortable do you feel in your community, trans people had the lowest level of feeling connected or comfortable with their community, which shows how much more work there is to be done. You had examples, you know, people would change their home when maintenance staff would come around, for example, from the housing association to fix something to make it less obvious that they were LGBTQ. So I think one thing that has to happen is within, in this case, within the housing associations, within the social housing sector, is to ensure that they've got inclusive policies. And making sure that that their staff are treating people inclusively and with respect. And one thing that we've added to our new affordable homes programme in the requirements, we've got new requirements around sustainability, design and safety, but also around equality, diversity and inclusion, and all requiring all the partners that we fund contractually to come up with an EDI action plan. So actually we have to mainstream these. Of course we need specialist services as well, and buying for services, that's always going to be the case, I think. But we have to mainstream equality within things like housing associations as well.
And that thing about what you were saying about not letting everybody else off the hook.
Yes, absolutely, absolutely.
Final comments from the panel before I open it out. Any burning things to chip in on, or I can offer it
I'd
out?
like to say
Yeah,
something
Maureen.
about it's just really frustrated me because what we think about allyship and what that actually means, and painting a flag on a road is not allyship. Get services. If you had services, if you had a trans youth group, if you had like support for trans people, actual services, then yeah, maybe paint a flag. But painting a flag, what does that actually mean? And yes, it's nice to have a bit of visibility and a talking point, but actually show that you're with us, not just, I think it's just a promotional sort of stunt, and it's quite meaningless.
And that's a challenge, isn't it, when people step up and try and do something visible, like raise the flag, and but actually what are your policies looking like?
It
What are your
needs to be
practices
something
looking like?
deeper than just putting a flag out and saying, oh well, we're trans inclusive. You're not. sorry, Camden.
A challenge there. Okay, questions, Layla, and then I'll come to Isla.
I've got a comment and I've got a question. My comment is everyone on this stage who's presented has put so many hours of their own time. Like, I know that the people who work, they don't have like a day job and a trans job or a day job, you know. So I think people need to be acknowledged for their dedication and deserve a round of applause, because I know some of you personally, and I know that it's not just 9 to 5, Monday to Friday, and the toll that it takes to support the community is great. So that's my first comment. And I just want to the question that I have, I've been listening to everyone who's speaking this morning and this afternoon, and it's like there's the community, the public sector, and the private sector hasn't been mentioned at all, and they are so loaded. Like, very recently, I got to do a treaty with corporate, but the amount of money that they have is insane. So my question to the panel is, how do grassroots opportunity feel about being sponsored by these big corporate organizations? I mean, Sainsbury can pay £40,000 for a flow that pride. Why don't they give that to these organizations? I mean, the huge difference that it would make to these grassroots organizations. So how would you feel about being sponsored by an organization which, I don't know, like McDonald's might not align with what you do? But then again, what is the public sector doing to bridge that gap? Because it seems to me that people are working in silo, and on one hand you've got a massive pot of money, and on the other hand you've got people struggling. I mean, the funding has been cut year on, so much so that people are literally walking around with a begging bowl at Christmas. There's too many charities to give to, so I'm done. Thank you.
Thank you. Well, I think that's a great question.
So it raises an ethical question, doesn't it, around principles, ethos, values. So as a kind of grassroots provider, how do our colleagues here feel about this idea of corporate support?
Thank you about when you said it raised an ethical problem, because issue. That's what came into my mind straight away. And then I thought, just give me the money, really. Good with it. So yeah, I mean, that's what I really felt. I'd take the money. But then I'll look at the ethics.
No, but I mean, there are companies out there. I mean, really the question, Tom, is like, what is the GMA doing to kind of sort of like bridge that gap and support, I don't know, maybe a construction company could be sponsoring some of these services. You know, it's about thinking outside the box and implement.
I like the idea of bringing in public sector bodies to sort of bridge some of that and do some of that brokering as well, like the GLA. It's a genius idea.
Thank you, Dave.
Thank you. Any other thoughts, Mari and Jolie?
Yeah, I mean, it's something that each year Pride season comes around and I see floats sponsored by like Co-op Funeral Directory or whatever. And I despair like most of us, but I think that the reality is that a lot of these private companies that will show public support for LGBT people for a month out of the year so that they can sell a sandwich or whatever they have absolutely no intention of supporting our communities in any material way. The other thing that I think is important to mention when it comes to the private sector is that there is a booming industry of private trans healthcare that is profiting off of the inefficiency of the NHS, where trans people are left stranded without healthcare for years at a time, and there are people becoming millionaires off of this, creating private trans healthcare services, charging trans people thousands and thousands of pounds to be able to access the kind of healthcare that the NHS refuses to provide them with.
Yeah.
And I think that there is that is not being addressed. That like we pride ourselves on providing a free, at the point of use, healthcare service in this country, and that is not the case for trans people at all, and hasn't been for a really long time. And I think that like there has to be some kind of community response to the people that are profiting off the death and the pain of my community. If they're willing to give me money to be able to provide like the services that I do, great, but they're not doing that, so fuck 'em.
Do you want to say anything?
I think, it's the same sort of thing. If they give us money, we'll take it. But ultimately, we're providing public services, and morally, I think it should come from the public purse. Really, we shouldn't be, having to smooth with corporates to fund vital life-saving services, and that's what we're all providing here. I don't think morally that I think morally it should be up to and local authorities to provide. That's another point, really, just quickly, is that the queer community is quite dispersed in London, and I think really we need the GLA what's the word?
Strategic authority?
Pan-London. To be able to provide some specialist services, and with Tonic and other people, we formed the London LGBTIQ Community Housing Coalition. Sorry, thank you, Anna. we formed that to build on the manifesto that we created during, which had a number of pledges. And we think really the GLA needs to be providing some oversight, some to employ maybe a specific worker to look at LGBT housing and to help us develop strategically, because I think going back to some of the things around like capacity, like trans people in particular, I don't know how to say this, often aren't very employable. I'm just going to be honest. You know, if I do a lot of recruitment, and I've done a lot of recruitment over the years, and unfortunately, because of the experiences of maybe not doing great at school, you know, like you're talking about being on benefits and the experience of trans people, you know, trans people generally are sort of living in poverty a lot of the time, and the sort of social issues around building, we need to, as a community, like do more mentoring, make sure we can help each other come up, because until we get the skills in the community, we're not really going to be able to have that capacity. And I think that's a key point really, that we all need to do more. I know we already do.
No, and I can concur there, because you know, we at GI, we employ, you know, we're a trans-led organisation and really keen to support trans employees coming through. And you know, we've got a bill from the ground up, really. People come through at entry level, and we're just like, what does management look like? What does leadership look like for trans people? And this is the next, well, who's going to do our jobs in 10 years, and we're not going to be here forever. And so there needs to be an investment around skills building, confidence building, more than anything. I actually think trans people are quite skilled and highly intelligent, but not necessarily confident, so don't really sell ourselves too well. But I'm just mindful of time, and I know Sian wants to do her end, so I'm going to have to end it there, I'm afraid. Sorry about that, but perhaps we can have a little bit of a mingle. You can approach the panellists to ask your questions. So thank you very much. Thank you to the panel. Big round of applause.
Yes, thank you, and also another big round of applause for the first panel. I think it's been such an amazing afternoon. Lots of takeaways and lots to work on. Thank you. And hereby, I'd like to ask Sian again to join us here. And thank you again, Sian, on behalf of Consortium and our communities for supporting this event. Fantastic to have your allyship.
Sorry, as most of you will have seen, I was taking notes throughout the entire meeting. It was really, really fantastic to have so many discussions and such interesting, expert, on-the-ground working panels that we had speaking today with such expertise. It's been so interesting. I want to thank Debbie, who spoke at the beginning as well, for being so clear that the discussions today would feed into her work in the GLA planning recovery. I think she made that really clear, and all the notes we've all been taking will go to her as well. In the first panel, we heard really usefully about how the use of storytelling and improving positive representation, allowing healing, creating restorative justice processes can help to include trans people in a really social way. We also heard about the importance of support within community settings, allies, bystanders, but also how preventative things need to be put in place. We need to make sure that people are able to access safe spaces and get between them as well. That was a really important learning for me there. We also heard that the brilliance of community initiatives and the work that is done shouldn't let councils and statutory service providers off the hook, that we still have to demand action and funding from them. I think in the second panel, what I took away from it was very much that lesson that we learned from the pandemic, that trans people, LGBT people who did not have safe homes really felt that during the pandemic, and how there have been initiatives that show that this old answer that you can't just throw money at the problem, well maybe we should try that and see if things are any better. Because actually, you know, you'd be surprised how much of a difference it makes to throw money at a problem. You know, we can end street homelessness, it turns out. So I think that it has shown that can happen, and has also shown that dedicated services are absolutely fantastic when they work as well. It's also expanded the access to asking for help which has created new demand problems. And that's a really interesting one, the fact that digital services have really just expanded the amount of people who will go and seek out help. That's I think, eye-opening. We talked also about how the census is going to tell us a lot more about need in our areas, and that's going to be so useful. We're all waiting for the census for many reasons. So, yeah, I think, the thing that I took away at the end there was as well that it's not just about making sure that there are specialist services. It is also about mainstreaming inclusion within existing services, within general services, and we have such a long way to go on that. In some ways we're going backwards with some of the initiatives that are going on with some of the campaigns, so I hope we can continue to work on that. And yes, as a green and a campaigner for many green NGOs over time, I've had no shortage of corporates approaching us, trying to use us for their greenwashing efforts. It is a dilemma, I feel, as well, and I think it is difficult to know where to get the money from. In my view, it should come largely from general taxation through government, from the people to the people, as according to need and all of that. But there you go. From what Debbie said, I think, we have got so much valuable data now, so much valuable evidence from the ground, from trying different things during the pandemic, that we really can take forwards into the recovery lessons that we need to learn. There's more than ever a need for bold action, for innovative action, for inclusive action that involves the people affected. And I think this is true of London's trans communities as much as anybody else. Thank you so much for listening and contributing your ideas. I'll just keep reading out my notes. No, I won't. I'll just thank you for coming. I'll thank every single speaker for your insights. I hope you'll keep in touch with our team. And very finally, I just want to say that my colleague Caroline Russell, who spoke up earlier about toilets, as chair of the Health Committee, is next Thursday, thank you, hosting a health committee meeting, also looking at the issues around access to trans healthcare in London. That is, I said, an official committee meeting. It's broadcast on the internet. There's a webcast. You can come in person if you want nowadays as well, yeah. Is it here? There you go. So I just want to plug that as well. Thank you so much. And again, have a good evening. Stick around for a bit longer. We could be thrown out of the room at some point, but we'll tell you when. Thank you so much. Cheers.
Hi. Just a final to say thank you again to Sian, her team, the London Greens, Anisha, thank you so much for your work in particular. Where are you? Oh, here you go. Thank you so much. I would like to thank the media company, Media Right as well. They're over there, lovely people. Just filming us. Also, our BSO interpreters, Joe and Stephen. Well. And I would like to tell all the Greater London Authority staff, including the security that have helped make this event happen. And last but not least, the Consortium team who are at the back. And thank you so much, everyone, for everything they've done. Thank you. Just stick around, as Sian mentioned, for a little bit before we get kicked out from the last event, potentially from City Hall. And I hope this is just the beginning and we'll see more of each other in person. See ya. Bye.